Thank you very much for inviting me to speak today. I'm very delighted to be here because I get to speak about a topic I'm hugely passionate about. And yes, I am vegan, but I'm not going to speak about that today. I'm speaking about a whole food plant-based diet or a predominantly plant-based diet and why we all need to be moving towards that for optimal health for ourselves, but also the planet. So what is the problem? The problem is that in the UK, most of the diseases that we're suffering with, chronic diseases, are caused and related to our lifestyle choices. And there's 5 lifestyle risk factors that are causing probably 80 to 90% of chronic diseases. And these include unhealthy diets as the #1 cause of death and disability in the UK, followed by tobacco, alcohol, lack of physical activity, and of course air pollution. And studies estimate that 80% of these chronic diseases could be prevented using a lifestyle approach. And 11% of all deaths in the UK are premature, so less than 70 years of age. These data show that premature deaths less than 75 years of age, and the majority are caused by cancer and cardiovascular disease. Now, Cancer Research UK and other international organisations tell us that more than 40% of cancers are preventable through healthy lifestyle choices, and probably 80% of cardiovascular disease, so that's heart disease and stroke, are also preventable through healthy diet, physical exercise, avoiding toxins like tobacco and alcohol. So what has gone wrong? We remain confused, partly because industry and media feed us different messages all the time. So in 1984 we were told that saturated fat and cholesterol from animal foods is bad for us, it's causing heart disease. Yet 30 years later we're being told actually it's fine to eat butter and this is not contributing to our ill health. And actually the information hasn't changed significantly, it's the way we're interpreting it and the way that these communications are being interpreted. So it's been clear for a long time that an unhealthy diet is one that's based around processed foods with added fat, sugar and salt, but it's also one that's high in animal products, rich in saturated fats. And the reverse is true as well, that these unhealthy diets are therefore low in whole plant foods, vegetables, fruits, legumes, whole grains, nuts and seeds and other high fibre foods. And this is the WHO telling us. The other problem in the UK is from our health and nutrition surveys that take place every year. We know that more than 50% of the foods we put into our shopping baskets are classified as ultra-processed foods. These are so far removed from the original ingredients, they have additives like salt, fat and sugar, and they've undergone cooking methods that generate toxins and carcinogens. But we have known for a long time what constitutes a healthful diet. And our guidelines and other international guidelines are hugely influenced by the dietary guidelines for America, which since 1980 has really been telling us the same thing. So point number 3 here on this 7-point guide, avoid too much fat, saturated fat and cholesterol. So that really means minimise animal foods. Point 4 says eat foods adequate in starch and fibre. So that means eat lots of plant foods. And points 5 and 6, don't eat too much sugar or sodium, essentially means avoid processed food where the bulk of our sugar and added salt comes from. We know a lot about diets that maintain health, and great example are the blue zones. These are regions in the world where people live the longest and healthiest, and they're the most number of centenarians compared to anywhere else in the world. And this is a picture of a centenarian in Okinawa in Japan, one of the blue zones. And what studies have shown is that there's 9 factors in common in all these regions. And when it comes to diet, the diet is composed of predominantly whole plant foods, so vegetables, fruits, whole grains and legumes. And animal foods are eaten probably about 5 times a month, special occasions only. And so when you look more closely at these 5 regions that are listed on the right of the slide, Okinawa in Japan we've talked about, but there's Nicoya Peninsula in Costa Rica, there's Sardinia, there's Loma Linda in California, and Icaria in Greece. You can see that the majority of the nutrients are coming from carbohydrates, and these are carbohydrates from whole plant foods. There's various amounts of fat, and fat doesn't have to be bad. It depends on the quality of the fat and what foods they're coming from, and these are mainly coming from plant foods, so olive oils, avocados, nuts, seeds. And there's minimal protein. You know, we have a fascination with protein, but actually the healthiest populations are not really eating much in the way of protein. And when you look at more recent information, these data are a combination of information gained from following large groups of nurses and other health professionals in the United States, and they're large studies conducted by Harvard University. And when they looked at over 170,000 men and women and looked at these 5 healthy lifestyle factors, so whether people had smoked, whether they were a healthy weight, healthy diet, whether they undertook regular physical activity, and whether they drank alcohol in moderate rather than excessive amounts. And when you look at the diet, which is in the table, a healthy diet was defined as one high in vegetables, fruits, whole grains, unsaturated fats from plant foods, and omega-3s that can obviously come from fish or marine algae, and low in intake of all the other foods that we've talked about, the red and processed meats, the sugar-sweetened beverages, and salty foods. What they were able to show is with each healthy lifestyle factor, there was incremental increase in the number of years that people lived, and these are healthy years. So at the age of 50, if you have all of these healthy lifestyle factors, men live 12 years longer and women live 14 years longer. And when it comes to looking at the diet, if you have an optimal diet as listed in that table, you have a 30% reduced risk of developing cancer and heart disease. So how do plant-based diets prevent disease? Well, we have to look to see what is actually causing these chronic diseases, and there's a handful of pathogenic mechanisms that is ultimately leading to a number of chronic diseases. There's what we call dyslipidemia, so abnormal fat deposition in the cells and in the organs, and this is essentially due to the consumption of high-fat and saturated fat foods, mainly from animal foods. There's oxidative stress and inflammation, so the way the body handles certain foods, whether they're processed foods or animal-derived foods, can trigger responses that inflame the tissue rather than healing it. The gut microbiome, so the trillions of bacteria, fungi, viruses that live in our gut, can either be healthy or unhealthy, and they become unhealthy if you feed them a diet full of processed foods, animal foods, high in saturated fat. And cancers are caused by abnormal cell growth, and our diet can either promote cell growth or inhibit the growth of these abnormal cells. So what plant-based diets do are provide nutritious food, low calorie density, which is really high in phytonutrients and antioxidants, that is mitigating the effect of all these inflammatory toxins and oxidative agents that we're putting into our bodies. You avoid carcinogens when you eat plenty of plant foods. You grow healthy gut microbiome that promotes health and prevents disease. And you improve your hormone profile, so you reduce the levels of growth hormones such as estrogen and insulin-like growth factor. So if you look at this very simple table comparing plant foods in the middle with meat foods on the right, you can see that the beans and lentils, as an example, are high in fibre, in phytochemicals, antioxidants, prebiotics that feed the gut bacteria, and plant steroids and stanols that keep our blood lipid levels at low levels. But when you look at the right-hand side, you can see that meat and animal-derived products are devoid of all these healthful components, but are very high in the inflammatory agents such as saturated fat, cholesterol, heme iron, which is also causing oxidative stress, and chemical contaminants from the environment. They really concentrate higher up the food chain in the fat of animals, and then we are consuming them, and they are related to the development of cancer and other inflammatory disorders. But when we look at the intake of fruits and vegetables, for example, sorry, we slightly lost the grams at the side, but the different bar colours are different amounts of fruits and vegetables. So the blue is 200 grams a day, the red is 500 grams a day, and the green is 800 grams a day of fruits and vegetables. You can see a stepwise reduction in the risk of cancer. So you can reduce the risk of cancer by up to 15% by just increasing your fruit and vegetable intake by 9 to 10 portions. And you can reduce your overall chances of dying by 30% by eating 9, 10, 11 portions of fruits and vegetables a day. And when we look at the evidence supporting the adverse effects for eating processed and red meats, what we know and what was published by the WHO in 2015 was that both processed meats and red meats have been classified as carcinogens. So they actually cause cancer. Processed meat is in the same group of cancer-causing agents as alcohol, smoking, tobacco, and asbestos. The risk is different, but the strength of evidence is just as strong. And in the UK, 20% of colorectal cancer, so that's 8,000 cases a year, are caused directly by eating red and processed meat. So, can we use diet as a form of treatment for all these chronic diseases? And the answer is a resounding yes. Has anyone heard of this gentleman, Dr. Dean Ornish? Oh, very good. Yeah, a couple in the audience there. Yeah. So my vegan friends have all heard of Dr. Dean Ornish. So this was published in 1990, and this was the man that Bill Clinton went to after his quadruple bypass to ask his advice about what diet he should eat, and that's when Bill Clinton went plant-based. So he showed in 1990, that's Dean Ornish, not Bill Clinton, Dean Ornish showed in 1990 that if you put people with heart disease on a diet composed of predominantly whole plant foods, regular physical activity, and stress-relieving activities such as meditation, you can arrest and reverse heart disease in around 80% of people. So this is the only diet that's ever been shown to reverse heart disease. And at the same time, in a different part of America, Caldwell Esselstyn was doing exactly the same thing. He was putting end-stage patients with heart disease and coronary artery disease with no other treatment options onto a whole food plant-based diet, avoiding animal foods, avoiding salt, fat and sugar. These people weren't asked to exercise or do any stress-relieving activities, they just changed their diet. And what you can see here on the left is one patient who at the start of the program had this area in the heart where there was no blood flow, so you can't see any uptake of the tracer here. But after 3 weeks only of a plant-based diet, this area of tissue in the heart, which didn't have any blood flow, has opened up and now has blood flow. And on the right-hand side, you can see an angiogram of one of his fellow colleagues at the hospital that he worked at. And he was in such a bad state, he asked for help from Caldwell Esselstyn. And you can see the left-hand image is a coronary artery with blood flowing through it, which suddenly then tapers into this tortuous route with blockages. But after 32 months of the dietary intervention, this artery is opened back up. And can you do the same with cancer? Well, the answer is yes. For some early stages of cancer, Dean Ornish has also shown that if you put people on a whole food plant-based diet, you can arrest or reverse the growth of cancer. And this is an example of prostate cancer, which after a year, in the group that was put on his lifestyle program, there was a decrease in the level of the prostate-specific antigen, a marker of the growth of the cancer. Whereas in those who didn't follow his lifestyle intervention because they were in the control group, there was an increase in the prostate-specific antigen level. And of course these are small numbers, and what we actually want is hard outcomes. And after 2 years, 27% of people in the control group had to go on and have surgery or radiation, compared to only 5% in the lifestyle intervention group. And what he was able to also show is how this diet was affecting the prostate cancer by taking biopsies before and after. And he was able to show that over 500 genes changed in the way that they were being expressed in the body, such that genes that promote cancer were being switched off and those that were suppressing cancer were being switched on. So, is this just a biased vegan view? Well, the answer is no. There now is international consensus that has caught up with these decades of science. So the World Cancer Research Fund recommendations, based on analysis of hundreds of studies, when it comes to diet, it says there in green, eat a diet rich in whole grains, fruits, vegetables and beans. It doesn't say eat a bit of meat, have a bit of dairy, have a bit of dessert. It says eat a diet rich in whole grains, vegetables, fruits and beans, and limit all the things we've been talking about: red and processed meats, sweetened beverages, and foods high in fat, sugar and salt. And this report really has been transformational this year. The Eat Lancet Commission brought together 37 scientists, experts in nutrition, health, policy, climate and environment, and asked them to come up with a diet that was not only healthy for humans, but also healthy for our environment. Because we've reached the point of climate crisis, really, and we've only got till 2030 to really sort out the issues of climate change. And our diet really is having the biggest impact of any other sector on climate change. And what they came up with was a plate that looked like this. And really, it's a plate full of whole plant foods. Half of the plate is fruits and vegetables, about a third is whole grains, and what you can see here in red is the tiny amount that is allocated to animal source proteins if you want, but you're encouraged to eat protein from plant sources, so this is legumes and nuts. And if you are going to eat meat, then it's once or twice a week, it's 1.5 eggs a week, or it's fish once or twice a week. And when you look at the calorie breakdown of where we should be getting our energy from, again, it's whole plant foods, whole grains, vegetables, protein sources here. It says that it's okay to take 0 amounts of meat, 0 grams of dairy. It's not essential, but what is essential is a combination of healthy plant foods. And what they have estimated is that a diet like this could save up to 11 million lives a year. That's globally, because that is the amount of deaths that's being caused by unhealthy diets. And not only is this diet optimal for human health, it's going to mitigate many of the effects of climate change. And just to briefly cover the issue of climate, because we can't really talk about diets that are healthy for humans without referring to the health of the planet. And much of this work has come out of the Oxford Martin programme on the future of food at Oxford University. And they've analysed the effects that would take place if globally we shifted to a predominantly plant-based diet. And they have estimated that we could reduce the greenhouse gas emission by up to 80%, whilst at the same time increasing the nutrient content of our diet and reducing premature mortality by 22%. And international food guidelines are also taking account of the information about human health and putting it together with planetary health. And these are the latest international diet guidelines. And this is Health Canada that have come up with this food plate just a few weeks ago. And again, when you look at this plate, half of it is fruits and vegetables, a third of it is whole grains, and the rest dedicated to protein. It says it's protein. It doesn't tell you where to get your protein from. It tells you to predominantly eat plant proteins, and if you want to eat a bit of meat, it's small amounts. Dairy doesn't even make it onto this plate because it's not essential, and it very much contributes to climate change. And when we look back at our Eat Well guide from Public Health England 2016, I'm very supportive of this, because you look at the plate again, and 2/3 of it are fruit and vegetables and whole grains. Very little is given to animal-derived foods, and it says eat more beans and pulses in the protein section, and it gives you alternatives for drinking milk. Soy drink is just as acceptable as drinking cow's dairy. So I hope I've covered in this short time a large body of evidence that supports a shift towards a more predominantly plant-based diet for prevention and treatment of chronic disease. I've shown you that national and international guidelines are catching up with this evidence, And we can no longer just talk about diets for human health, we have to consider planetary health as well. Thank you very much.